And our correspondent Lucy Huff is joining us live from Brussels. Lucy, thank you so much for joining us. Germany is suspending the routine use of Oxford-AstraZeneca vaccine. What is the latest that you can tell us on this?
Well, this comes after a number of German states, including Berlin and Munich, decided to suspend the use of the vaccine in the under-60s age groups after a number of cases reported around Germany of blood clotting in small numbers, admittedly, given the number of people that have received the vaccine, but some 31 people who developed blood clots shortly after receiving the Oxford-AstraZeneca vaccine. The vast majority of those, all but 2 women aged between 20 and 63. Of that 31, there were 9 fatalities and some around a dozen severe symptoms. So regions like Berlin and Munich, where these cases were reported, decided to suspend the vaccine in the under 55 age groups, and in the Berlin Charité hospital this was specifically women. But after this emergency meeting on Tuesday, there was a decision to implement this restriction nationwide. German Chancellor Angela Merkel has admitted this is a setback, but she said really these are figures that can't be ignored and that Germany needs to act out of the utmost precaution.
All right, now, as you of course know, Germany is among several states fearing a third wave of infections. Considering that, do you think the decision taken at this stage is a rational one?
Well, certainly, you know, the cases, there is real concern in Germany about these incidents of blood clots, despite the advice from the European Medicines Agency, the EU's health regulator and the WHO that there is no proven causal link at this stage between the Oxford-AstraZeneca dose and as any risk of blood clotting, although the EMA has said that it will be investigating that link further and that more further probe needs to be carried out. But like elsewhere in Europe, Germany's vaccination programme is moving relatively slowly. The country has vaccinated around 10% of its population compared to more than 50% in the UK. Meanwhile, case numbers are continuing to spike. Germany is being forced to consider yet further lockdown restrictions as hospitals in major cities continue to fill up, as pressure continues to mount on healthcare systems across the country. So the AstraZeneca vaccine is critical to its vaccine rollout, and any further restriction on this dose, on this shot, will hinder that rollout yet further. So whether it's rational or not, it could be that there is yet further evidence of a causal link between these small number of cases of blood clotting, but nonetheless it will yet further hold up the pace of Germany's rollout.
All right, and do you think the fears about AstraZeneca's vaccines are unfounded after the WHO and EMA have already said that the vaccines outweigh the risks?
Yeah, I mean, that's certainly been the key message, is that, as I say, there's no proven causal link at this stage, that the benefits of the vaccine, which prevent, severe hospitalisation, severe numbers of deaths from COVID-19, far outweigh the risk of really very small numbers of blood clotting, which in the vast majority of cases aren't in any way severe. That has certainly been the message of both the European Medicines Agency and the World Health Organization, that countries should press ahead with the use of the Oxford-AstraZeneca dose in order to get the pandemic under control, with the risk of the pandemic far outweighing the risk of a very small number of blood clots. But nonetheless, Germany has this concern about this number of 31 people who've reported blood clotting in the wake of or shortly after receiving the Oxford-AstraZeneca dose. More investigations will be carried out, but clearly Germany is concerned enough to take these steps, even though it said it will be a setback in its vaccination rollout.
All right, Lucy, thank you so much for joining us with all those details. WION is now available in your country. Download the app now. Get all the news on the move.